Career Exploration Research Project. So a little bit about me. My name is Jessica McDonald and I'm a sophomore here at UWM. I started as a film major and then I realized that it really wasn't what I wanted to do with my life, so I switched to a psychology major. My end goal is to work somewhere in child psychology, either in an office or school setting or a hospital setting. And the career I looked into is a health psychology intern in a hospital setting at UW Health. So what to expect in this presentation is that I'll be looking at what it takes to not only get the internship and explain about what the internship is about, but also more about the company and some questions that I would ask if I was given the chance to interview. The description of my internship is that it's an internship that I looked into. The description of my internship is that it is a health intern at one of UW Health's clinics in Madison, Wisconsin. To be considered for the internship, you need to have completed grad school in the psychology field. And the job is working with patients in an inpatient or outpatient facility and also has some research aspects to it. I'm currently not qualified for this job because I have not graduated yet, but once I graduate, I would be. So the organizational research is what's coming up next. I'm going to be giving you some information about how UW Health does business, which will include an overview of the organization, its strengths, its weaknesses, and the overall culture of the organization. So UW Health has over 10,000 employees who are all in charge of different things within the company. UW Health's mission is advancing healthcare without compromise through service, scholarship, science, and social responsibility. UW Health's vision is remarkable healthcare. And then their company goals, UW Health is guided in the pursuit of its mission and vision by a set of core values, and those values are excellence, innovation, compassion, integrity, respect, accountability, and diversity. So some history about UW Health is they've been around since the 20s, which is crazy. It was created actually by the University of Wisconsin-Madison to offer students a hands-on experience in the medical field if that's what they were going into or studying. And they have had so much success, not only in like their hospitals and treating people, but also in research. They've actually found a way to detect Alzheimer's almost 20 years before symptoms even start, which is crazy. So since it's a hospital, they offer a lot of different services, like emergency rooms, doctors focused on psychology. This would be more of like counseling in different types of situations. So they offer an inpatient program and an outpatient program. An inpatient program would be for someone who, let's say, is having like suicidal thoughts and they just need to go somewhere and stay as long as they need to and get help that way. And outpatient would be someone who comes in for counseling once a week or a couple times a month and gets help, but then goes home at the end of the day. Some strengths, I would say their biggest strengths is their hospitals. They have amazing hospitals. Madison has some of the best hospitals, not only in the state, but in the country. And the Children's Hospital is probably one of the top. It's incredible. So some questions that I would ask is, can you tell me more about what the day-to-day life is like here? This one I would ask because I think it's important to understand what's expected of you while you're at work. And then you kind of get a head start to know what life is like and how people kind of go about their day. And an answer that I would expect for that would be something like it's different every day, because I believe that some clients are going to definitely be more challenging than others, and some days you'll have more clients than other days, some days it might be slow, so it just kind of depends on the day. And then my second question would be, what is the biggest challenge of the internship? This one I would ask because I think as someone interviewing for the new job or internship, I want to know some things that maybe aren't as great. I feel like when you're in an interview, people generally tell you why it's so great and why you want to work here, and you kind of need to know some of the things that maybe why you wouldn't want to work there, even if you're still going to take it, just to know what to expect. And an answer would be along the lines of that it's hard to not take these people's problems home with you, which I think is probably going to be a big issue. And then in conclusion, I can definitely say that I would see myself here. It's kind of fast-paced, and I think that that's something that I'd be really good at. I would definitely see myself more in a children's hospital setting if I went the hospital route, just because that's my goal. My end goal is to work with kids. And I think that I would have an issue with not taking other people's problems home with me. You don't want to bring that stuff into your own life, and that's definitely something that I would personally, I think, struggle with. But I think it would be an awesome opportunity, and I hope it's still available when I graduate so that I could apply for it and maybe be eligible. So yeah.